Hello everyone, welcome to my YouTube channel. This is Dr. Naz and today I'll be discussing about erythema infectiosum, also known as fifth disease, which is caused by parvovirus B19. So without any further ado, let's get started with our topic. Parvovirus B19 is a DNA virus with an incubation period of 14 to 21 days. It mostly affects children but can affect adults as well, especially the individuals with the sickle cell disease and HIV. It causes serious illness in these individuals. After the incubation period, prodromal phase starts, which include fever, malaise, headache, conjunctivitis, coryza, pharyngitis, cough, nausea, diarrhea, myalgia. These all are the symptoms which occur in any viral illness, so this is easy to memorize. There is no appearance of an anthem, that is no rash on mucous membranes seen in parvovirus B19. So skin rash appears after the prodromal phase and it first appears on the face and it is intense red rash. That is why it is also known as slap cheek syndrome. After the appearance of rash on the face, it is followed by lacy reticular rash over the trunk and extremities, and it is pairs, palm and soles. So now we will discuss about the complication. Gloves and socks syndrome is one of the complications. It is a purpuric rash with a clear margin at the wrist and the ankles. In the pictures you can clearly appreciate the rash with a clear margin. So it's called gloves and socks syndrome. Joint involvement is more common in adults and it is mostly symmetrical and multiple small joint involvement. So another complication is impaired erythropoiesis. So in adults and older children, acute pure red cell aplasia is most commonly caused by parvovirus B19 infection. The virus invades and destroys the red cell progenitors and it results in aplastic crisis, especially in those with underlying hematologic abnormalities like sickle cell anemia and HIV. But the good thing is erythropoiesis recovers spontaneously after 10 to 14 days. It is because the neutralizing antibodies against parvovirus B19 are developed by this time. Hydrops fetalis is the most common manifestation of fetal parvovirus B19 infection. What happens is that fetal erythroid progenitor cells are infected and the half-life of erythrocytes becomes short. This causes high output cardiac failure and therefore it causes non-immune and non-rhesus hydrops fetalis. The ultrasound will show ascites, subcutaneous edema, pleural effusion, pericardial effusion, scalp edema and polyhydramnios. So how the diagnosis is made? The diagnosis of the disease is usually based on the classical slap cheek rash, which is noted on the clinical examination of the patient. In rare cases, blood test can be done to look for specific antibodies against parvovirus B19. The treatment of the disease is mostly supportive. Plenty of fluids, acetaminophen and the rest can provide some relief to the patients. Patient with persistent arthritis can use anti-inflammatory medications such as ibuprofen, naproxen, although children should avoid aspirin due to developing risk of Reye syndrome. Pregnant women should avoid contact with the cases of parvovirus B19 infection due to the risk of developing hydrops fetalis. If they are exposed, perform serology to know the immunostatus. Pregnancy should be closely monitored by ultrasound. Fetal transfusions should be done if hydrops fetalis is detected on ultrasound. Thank you so much for watching my video. Make sure to like the video and subscribe to my YouTube channel so I can get motivation to make further such videos. I am trying to make them as concise as possible. If you have any queries, you can comment in the comment section and that's it. Thank you.